I guess since this microphone is low, I'll sit down here. Yeah. What was that? Yeah. Okay, we can do it like that. Everybody can see me? Okay, very good. Thanks, Dr. Stefan. And let me start by saying that we'll be talking about tinnitus primarily. Initially, Noel and I were going to talk about a lot of different things. And when I got to just the tinnitus topic, I figured I had enough to talk about just on that. But we'll touch on a little bit of hearing, and Noel will be talking mostly about amplification with hearing aids. First of all, the definition of, actually, how many people here have tinnitus? It's like half, okay. You have two tinnitus, both ears? Deadly, okay. Okay. Basically, the definition of tinnitus is the perception of a sound that nobody else can hear. That's somewhere in your head or in your ears, and nobody else can hear it. Tinnitus is not a disease. It's actually a symptom of something else going on. And there are multiple causes for it, primarily hearing loss. That's the number one thing that causes tinnitus. But it affects a lot of people. You can see here just in this room, about 50% of the people have tinnitus. But it affects about 50 million Americans. The estimated prevalence is between 10 and 15% of everybody. But only about 10 to 15 million people seek medical attention, and 2 million people have very, very severe tinnitus that really requires some type of treatment. And if you think about our servicemen, how many people here were in the service? And of those, how many of you guys have tinnitus? Okay, again, about half. But they predict that by the end of fiscal year 2016, nearly 1.5 million veterans will receive some type of disability award just because of tinnitus. And as Dr. Stefan is going to work for the Medicare Advantage, you know that's big dollars, $2.75 billion just spent on veterans with tinnitus. Noel told me this is a very educated group here, so I'm just going to just briefly talk about how we hear. I don't want to insult anybody here. As the sound is passed from the outside of the ear, I don't have a really pointer, but that's okay. As the sound is being passed from the ear, your external ear, the thing that we call the pinna, which is on the outside, collects all the sound. It's just really just this one slide. Yeah. And the sound is funneled through the pinna into the ear canal. And then we have like a little bit of an issue, because the sound, which is in air, has to go to a water-based area, which is in the inner ear. And as you all know, that if you're underwater and somebody is talking to you, you don't hear a thing. Whereas if you tap like a rock or something like that underwater, you can hear that for miles. Because sound in the same medium will travel long distances. So in the ear, you have the eardrum, which works as a microphone that collects the sound, and then it goes through three little bones. This microphone might be too loud. Can you understand me? Okay. All right. So three little bones acts as like kind of like an amplifier, so that the sound, as it hits the inner ear, the water, it's amplified to the point where the nerve endings can pick up the sound. So what are the risk factors for tinnitus? Number one, being male. Well, guys can't hear anyways, so that's the reason why they have tinnitus. Arthritis. A lot of the medications that people take for arthritis, like aspirin and non-steroidal anti-inflammatory agents, make tinnitus worse. If you stop those medications, it stops the tinnitus, but a lot of those patients just need that medication in order to be comfortable. Head trauma. Any kind of head trauma, either a blunt trauma or like a blast injury. This is why a lot of our veterans have tinnitus. Will cause head trauma will cause tinnitus. Hearing loss. That's the number one factor. If you have hearing loss, chances are you have tinnitus. Tobacco use is again a factor. It decreases the blood supply to the inner ear. It does a lot of things, but that's another risk factor for tinnitus. I talked about hearing loss. There's two main reasons why people have hearing loss or a nerve hearing loss. Number one is who you picked for your parents, your genetics, what you're made of. And in some people, you're just pre-programmed to start to lose hearing. The other factor is noise. And although we can't control who we pick for our parents, we certainly can control our noise exposure. And according to OSHA standards, basically sound that is 95 decibels or greater, which is typical like a train coming down a track, is about 95 decibels. If you hear that for about 4 hours, over time, you will start to lose hearing. Now, if the sound is louder, like 100 decibels, you only have to have exposure for like 1 hour. And again, over time, you'll start to lose some hearing. Although OSHA has its standards now in factories, a lot of kids are running around with headphones. And I always tell parents that if you can hear, if there's somebody with headphones and you can hear them, it's way too loud. It's over 100 decibels. And so if a kid is walking around or somebody's walking around with headphones and you can hear them, chances are if they do that over time, or if they listen to that for more than an hour a day, which a lot of people do, you can start to lose some hearing. Let me talk a little bit, before I get into the tinnitus guidelines, let me talk about the natural history of tinnitus. Because people always are asking me, like, is this going to get worse? Is this going to get better? The fact is, about 50% of the time, it's going to get better. It's going to go away. And what happens is you just basically get used to it. How many people here are like aware that they have shoes on? I mean, you don't really think about it because you put it on in the morning, and your brain has an ability to turn off extraneous information, and that's called habituation. And for the most part, people with tinnitus will eventually habituate, and the tinnitus will go away. So that's the good news. I guess the bad news is that if you're younger, it's better. It'll go away faster. And if the tinnitus has only been around for a little while, for less than 6 months, chances are it'll go away. Tinnitus can also fluctuate. Sometimes, people can have it and, think about it, and then it goes away, and then it can come back again. So you have to understand this. And when I talk about the treatment for tinnitus, this has to be kept in mind, because a lot of the treatments that you see out there really are just going by the natural history. Most of the treatments that we have for tinnitus, patients get better about 50% of the time. Well, they'll get 50% of the time anyways. So, 94% of patients who come to see a physician are told nothing can be done about this. And that's really not true. In October, Noel wanted me to give you guys the most up-to-date information. Well, this is the information that came out October 1st this year. So it's basically a month old. A group of people, a committee, was established, and it comprised about 30 different people. And there were physicians, there were neurotologists like myself, there were otolaryngologists, there were family physicians, there were neurologists, there were audiologists like Noel, psychoacousticians, people who study about how sound is perceived, nurse practitioners, and then just people, just consumers that they all got together, and what they did was they looked at all the articles that are published on tinnitus, all the good articles, let's say, and they came up with over 600 articles. These are things that are published in medical journals, and from that they actually only got about maybe about 225 that they considered good medical data. And that's what we try to do in medicine nowadays, is we want to have what's called evidence-based medicine. We want to have proof that something works. We're not going to do anything, we're not going to recommend anything unless we have proof that it works. We're not going to just, wing it. And then they had several questions, which I'll go into. And they had what's called strong recommendations on some things. Now, strong recommendations could be for or against, and this is based on clear evidence. These are really good papers. These are articles published, double-blind studies that are really rigorous information. And then there were things that they could recommend. And these were articles that were double-blind, but there might have been some problems with the studies, so they might not be the best studies, but these studies kind of showed, a leaning in one direction or another. And then there's opinion. And basically opinion is kind of like, well, I saw a patient who I gave him this medicine and he got better. And that's about it. So there's not really a whole lot of science behind it, but we kind of have a feeling that it may work. And those were what's called a grade D type of studies. Well, the first thing they talked about is history and physical. Okay, basically seeing a doctor and having them take a history and ask you some questions and take a look at your ear. Sometimes tinnitus could be cured just by taking wax out of your ears. I do that all the time. Patients come in, they have hearing loss, they have wax they have tinnitus, they're scared that they can't hear. Pull the wax out, they walk out of the office and they're cured. Easy. Sometimes it's more complicated than that. Yes, and I've seen that actually several times where patients would, I don't know if they get their hair cut or whatever, and a hair may fly into their ear, which is very easy, especially if they cut the hairs inside your ear. Sometimes that little hair can stick on the eardrum, and if it's like scratching against the eardrum, it'll be like a needle on a record. And every time they talk, it'll move just a little bit. Just has to be like a few, like not even a millimeter, just a hair. And they'll hear the scratching sound. They come in, you pull it out. They move their mouth or they move around, and they don't hear it. It's gone. So that's the easy stuff. So the committee that did these guidelines recommends that you see somebody, either an audiologist or a physician, and have them, take a look at you, take a look at your ear, and see if there's something going on there. The next question is whether or not you need a hearing test. Now, not everybody needs a hearing test. In fact, if you have tinnitus and it's been less than 6 months and it's in both ears, or then basically you don't need a hearing test right away. Now, if it's been more than 6 months, or if it's just in one ear, or if you notice that you have difficulty hearing, then you need a hearing test. So the committee did make a distinction regarding the need for a hearing test. Now, you don't need a scan. You don't need an MRI scan. You don't need a CAT scan. In fact, the committee strongly recommends against getting a scan, unless there's some other reason for it. In other words, if you have some type of neurological problem, if after they do the hearing test, you notice that the hearing is a lot worse in one ear versus the other, if you're definitely sure that the tinnitus localizes to one side. The other thing is if you have pulsatile tinnitus. This is kind of off the subject, because pulsatile tinnitus is like a pulsation, like your heartbeat. Well, that's a whole different ball game than just regular subjective tinnitus. If other people can hear the sound, then it's not what we're talking about. But anyways, if you do have a pulsation, a pulsatile tinnitus, you do need some type of imaging studies, because it could mean some type of vascular abnormality, or it could mean a tumor that can cause that kind of thing. But those are very, very rare. Now this seems obvious. I mean, patients are coming to your office, and they're concerned about their tinnitus, and one of the things that the physician or healthcare provider is going to determine is, does this bother you, or are you just here for curiosity? I mean, there are a lot of patients come in, and they got this ringing in my ear. What do you think about it? And sometimes just a very simple explanation is all the patient needs. And that's it. You don't have to go through any kind of special testing or any kind of special treatment if it really doesn't bother them. It's very important that the healthcare provider also counsel and educate the patient, just like I'm doing right now, is explaining to the patient what the natural history is, what the underlying cause is for their tinnitus, and what are the treatment options. And this is, again, something that the committee recommended. Now I'm going to get into some of the treatments. There's a lot of different treatments out there. I'm sure you've seen it on TV. This pill, that pill, whatever will cure your tinnitus. But there are certain things that were recommended that, again, are evidence-based, that are proven scientifically whether they work or not. And one of the main treatments is a hearing aid. You have a hearing loss, and you have tinnitus, but you have a hearing loss. You got to treat the tinnitus. You got to treat the hearing loss, because that's the primary thing. Is if there's no treatment that turns off the tinnitus. There's nothing that will make it go away other than you have to treat the underlying cause. Okay, because again, tinnitus is a symptom. It's not a disease. Okay, you got to treat the disease to treat the symptom. Sound therapy. And actually, Noel's going to talk a lot more about. No, you're not. Okay. All right. Okay. Sound therapy. This is another treatment that the committee rated as an opinion. In other words, it should work, but we really don't have any strong evidence that it works. Remember I talked to you about habituation. Basically, sound therapy is it can be as simple as turning on the TV at night to have some background sound to mask the tinnitus, or you can get actually a tinnitus masker. There's also a device called a neuromonics, which basically plays a melody, some type of tune, and embedded in that tune is like a white noise that blocks the tinnitus. And eventually you could turn off the white noise or the noise and just listen to the melody, and eventually your tinnitus will be habituated. Now, there's actually strong evidence that that does work, but there were some issues with the studies that they performed. But that's something to consider. It's called neuromonics. Next is, and actually I'll go back to the neuromonics in a second, but next is cognitive behavioral therapy. Basically, that's teaching you how to deal with the issue of tinnitus. There's two components to tinnitus. There's basically the perception and the reaction. You can have the perception of tinnitus, and basically you don't care about it. It's there. It's in the background. You just kind of forget about it, or your reaction can be very distressed by it. So cognitive behavior, CBT, is a way that a psychologist who's trained in doing this can teach you just not to notice it, or to think differently about it. An example is, let's say you have tinnitus and your wife wants to go out to dinner, and you say, well, I don't want to go out to dinner because I won't be able to hear anybody over the tinnitus. So you stay home, your wife goes out, you're upset, she went out, and that's what you shouldn't do. What you should do, with CBT is to say, well, maybe I have tinnitus, but you know what? If I go out with my friends and my wife and I have a good dinner, I'm going to enjoy myself, And so maybe I don't hear anybody, but maybe I'll enjoy the meal or whatever. It's a positive turn on what you're doing. Medical therapy. There are some reports that things like antidepressants, anticonvulsants, anxiolytics can be used to treat tinnitus. Now, I have to tell you that there is no drug that's approved by the FDA to treat tinnitus. Okay, there's no drug approved by the FDA to treat tinnitus. And that should not be the first line of therapy, to treat that. Now, if the patient already has depression or anxiety, then the proper physician, either your family physician or a psychiatrist or somebody who's qualified to do that, may treat you, but they're not treating the tinnitus, they're treating the depression. Okay. So it's there's no medical therapy that's recommended. Dietary supplements. You see on TV all the time, take this pill and your tinnitus will go away. Well, again, the committee recommends against this. One of the number one medication is, or dietary supplement is ginkgo biloba. And that actually is an antioxidant. It's also a free radical scavenger. And it's also it also thins out the blood too. So it's probably not something you should take. I mean, it probably wouldn't hurt you unless you're also taking some type of blood thinner. Okay, if you're on Coumadin, you really shouldn't be taking ginkgo biloba. You've seen patients like that? Yeah. Melatonin. Now, I got to apologize because I was actually one of the first physician. Actually, I think I was the first physician to talk about melatonin as a treatment for tinnitus. And it all came because a patient came to me, and this wasn't a scientific study. A patient came to me, and they took melatonin to help them sleep on an airplane. And the patient told me that his tinnitus went away with the melatonin. So we decided to do a study, and to be honest with you, it wasn't a very good study. We were just kind of like, just to see if it worked. And we figured it wouldn't hurt anybody. And the melatonin is actually a neurohormone secreted in your brain that tells you to go to sleep. It's secreted in your brain at night, and if you took it as a supplement, it'll just make you sleepy. What we actually did find in our study was that it didn't make the tinnitus go away, but it made patients sleep better. So we said that if you have a problem sleeping with your tinnitus, go ahead, take it. But again, this is not recommended because there really haven't been any really good studies. And we just did a pilot study. It was actually one of my most famous papers because I was at a meeting, a national meeting, giving this paper, and I came off the podium, and somebody from the Otolaryngology Academy came up to me and says, the people from Good Morning America want to speak to you. And I was like, how did they know about this? But apparently they knew, and they were real interested, and they interviewed me and everything. But it was just shows you how desperate some people are about tinnitus, that will do anything. And this is what these guidelines are to prevent, is for people to spend a lot of money, a lot of time, doing stuff that really is not good science. The last thing I want to mention is transcranial magnetic stimulation. There are some reports that if you apply a strong magnet to your head, it will help prevent the tinnitus. And they weren't very scientific studies, and again, this was strongly recommended against. One thing I didn't have a slide on is acupuncture, and it's real interesting. The committee looked at this type of treatment, and they basically gave no recommendation. So in other words, they didn't say it was good or bad. They just said we don't have anything to say about it. But I'm just giving you that information because I forgot it on the slides here. So that's pretty much it. As far as the latest treatment for tinnitus, or latest concept of treatment. How am I doing? Do you want me to answer any questions at this point, or? No. That's it. I covered everything. Well, the thing is, only you can hear the tinnitus. You're saying, like, if the tinnitus is a bad tinnitus or good tinnitus? Is that the things that you need to know is that if it's coming from just one ear, then you really need to see somebody. That's for sure. And if it's basically equal in both ears and it doesn't really bother you,